Did you know that something as simple as sitting for too long could put your life at risk? That nagging pain or swelling in your leg might not just be from fatigue or overexertion, it could be something much more serious. A blood clot, deep inside your veins, slowly threatening your health. Today, we're diving deep into an often overlooked condition, deep vein thrombosis, or DVT, and revealing why it could be lurking in your body right now, waiting to strike when you least expect it. Stick with me because you'll learn how to spot the warning signs, what's causing this hidden danger, and how to protect yourself from its deadly consequences. Let's start with the basics. What is DVT? Deep vein thrombosis is when a blood clot forms in one of the deep veins, typically in your legs. These veins are buried deep under your skin, which makes them harder to detect. Imagine your veins as highways for blood to travel to and from the heart. But sometimes, these highways get blocked by a clot, creating a dangerous traffic jam. This blockage can cause swelling, pain, and heat in your leg. Sounds pretty uncomfortable, right? The scary part? Sometimes you won't feel any symptoms at all. No pain, no swelling, nothing. You could be walking around completely unaware that you've got a ticking time bomb in your veins. 2. Why does DVT happen? Now, you might be wondering, why does DVT happen? There are a few culprits. First of all, anything that messes with blood flow is a risk. Sitting too long, whether you're on a long flight, stuck in traffic, or lying in bed after surgery, could slow down your circulation. Without movement, the blood in your legs starts to thin, and that's when clots can form. Think of your leg muscles like a pump, constantly moving blood back up to your heart. But when you're sitting still for hours, your muscles don't contract enough to push the blood upward. This sluggish blood flow makes it easier for clots to form. 3. Risk factors for DVT. But there's more to it than just sitting still. Certain health conditions and lifestyle factors increase your risk of developing DVT. Let's take a look. Age. If you're over 60, your risk of DVT increases. But it's not exclusive to older adults. Even younger people can get DVT if they have other factors at play. Immobility. Whether you're traveling, recovering from surgery, or dealing with a condition that keeps you in bed, staying still for long periods increases the chances of clotting. Pregnancy. Pregnant women face more pressure on their veins, which increases the likelihood of DVT. This risk can last up to 6 weeks after giving birth. Obesity. Extra weight puts more pressure on the veins in your legs, making blood clots more likely. Smoking. Smoking affects blood flow and clotting, raising your DVT risk. Other factors include hormonal changes from birth control pills, cancer treatments, heart failure, and certain genetic conditions like factor V Leiden. Yes, some people are simply born with a higher likelihood of developing clots. 4. DVT symptoms. How to spot it. So, how do you know if you have DVT? Well, the symptoms vary. You might notice swelling, pain, or tenderness in your leg, often in your calf. The skin in the affected area might feel warm to the touch, and it could even turn red or purple. But keep in mind, DVT doesn't always come with noticeable signs. Some people walk around with it for days or even weeks without knowing anything's wrong. 5. The danger of DVT, pulmonary embolism. Now, let's talk about the real danger of DVT, pulmonary embolism, or PE. When a blood clot breaks free from the vein, it can travel to your lungs and block blood flow. And that, my friends, can be deadly. The symptoms of a pulmonary embolism include sudden shortness of breath, chest pain, dizziness, and even coughing up blood. If you experience any of these symptoms, it's crucial to seek emergency medical help immediately. This could save your life. 6. Diagnosis. How doctors detect DVT. So how do doctors diagnose DVT? The primary test is called a duplex venous ultrasound. This non-invasive procedure uses sound waves to show blood flow and detect clots in your veins. In some cases, additional tests like MRI or CT scans may be used, especially if the clot is located in an unusual spot. But most commonly, a simple ultrasound does the job. 7. Treatment and prevention. Okay, so what happens if you're diagnosed with DVT? Treatment generally involves medications known as blood thinners, anticoagulants, to stop the clot from growing and prevent new clots from forming. Compression stockings can also help reduce leg swelling and improve blood circulation. And in more severe cases, procedures like an IVC filter may be necessary to catch any clots before they reach the lungs. 8. How to prevent DVT, practical tips. Prevention is key. If you're sitting for long periods, whether traveling or working from home, take breaks to move around every hour. Stretch your legs, stand up, and walk if possible. Don't cross your legs while sitting, and try simple exercises like raising your heels while keeping your toes on the floor. Also, stay hydrated and avoid smoking. If you're overweight, maintaining a healthy weight can significantly lower your risk. To wrap up, DVT may not always show obvious symptoms, but it's a condition you definitely don't want to ignore. Keep an eye out for the signs, follow the prevention tips, and take action if you notice anything unusual with your legs. Your health is in your hands. If you learned something new today, don't forget to like this video and subscribe for more health tips and insights. Stay safe, stay healthy, and I'll see you in the next video.